Hello and welcome. This brief video will review the MIPS value pathway called Value in Primary Care, and it's intended for primary care practices who are currently reporting traditional MIPS. We invite you to get a hot beverage and review the upcoming video. So why not report MIPS using this value pathway? Couple of reasons that you might want to consider it is it will prepare you for the future. CMS will sunset traditional MIPS in future rulemaking. The measures included in this MIPS value pathway align with work already being done to satisfy other initiatives. And finally, if you elect to begin performing advanced primary care management and bill using those codes, it's a requirement that you report MIPS using this MIPS value pathway. If, however, you are participating in a MIPS alternative payment model, you can continue to report via the APM performance pathway. If you are already part of a MIPS APM, that's the path to take. If not, consider the MIPS value pathway value in primary care. Let's learn more. The focus of this MVP is on the clinical theme of promoting quality care for patients in order to reduce the risk of disease, disability, and death. There are 5 parts listed here. For quality measures, from a list of 13 measures, you will select and report on 4 measures that are appropriate for your patient population. At least one measure must be an outcome measure. Data on these quality measures is reported for the calendar year. Many of these measures you'll see are very familiar to you, while others are new. So let's take a look at the list. So here is the list of the 13 quality measures for this MVP. And a few may stand out to you already as being very familiar. Number 1 and number 4 have been part of quality reporting since the beginning. And those are highlighted in bold along with number 9 to show that they are outcome measures. So you may elect to select one of those as your outcome measure. And there are several others to choose from. Some that may align with work being done for other initiatives might include number 10, screening for social drivers of health. And perhaps you may be working on implementing medication for opioid use disorder, perhaps, and number 5 is a measure that relates to that quality of care. The next part of this MVP falls under the category of improvement activities. In the early part of the year, you will select which activities you will work on and develop a plan. Next, you will implement the plan and compile the documentation that supports your work. For 2025, you need to select just one improvement activity. If you are an accredited PCMH or patient-centered medical home, you simply need to continue the work you are already doing for that recognition. According to CMS, common examples of documentation for these improvement activities may include a screenshot or digital capture of relevant information that supports your attestation, improvement plans or outlines that show the strategies and processes you use to meet the intent of the activity, or a report from the electronic health record that contains documentation that's relevant to the activity. You don't need to submit any of this documentation, but you must keep it on hand for 6 years in the event of a CMS audit. Are you ready to learn more about what improvement activities are part of the Value in Primary Care MVP? There are 17 to choose from. The reporting period is 90 days, so you have time to look at the options. One activity that might align well with work you are already doing for other initiatives, like Medicaid managed care or making care primary, is the activity to engage community resources to address social drivers of health. Or perhaps choose the activity around implementation of food insecurity and nutrition risk identification and treatment. Maybe another activity aligns with your patient population or with something you already know needs some improvement in your practice, like timely communication of test results, use of the patient portal, or medication management, for example. Details describing each of these activities that'll help you choose are on the QPP website. The cost portion of MIPS is based on Medicare claims, so you don't need to submit any data. Clinicians are scored on cost measures for which they meet or exceed established case minimums for patients with asthma and chronic obstructive pulmonary disease, diabetes, depression, and heart failure. These are difficult chronic health conditions, but what we know is that if patients are managed well in the ambulatory care setting, they'll not only feel better, but complications and exacerbations can be avoided or minimized, thereby lowering costs. Total per capita cost is also a part of the cost category. Considered one part of the foundational layer of MIPS, the promoting interoperability measures are the same for MIPS value pathways as they are for traditional MIPS. You're familiar with these. These include things like e-prescribing, conducting a query of the PDMP, performing a security risk analysis, electronic exchange of information, registry reporting, etc. The second foundational layer is population health. It's not a new performance category, but it will be scored as part of the quality performance category, provided the case minimum is met. Both measures here focus on hospitalizations, and CMS calculates them using administrative claims data. You do not need to do anything during your MIPS registration or reporting. For the first measure, the outcome is any unplanned readmission within 30 days of discharge from an index admission. Some exclusions apply, and again, these are measured using claims data. The second is a more complex measure. It's a risk standardized rate of acute, unplanned hospital admissions for Medicare fee-for-service patients aged 65 and older with 2 or more of 9 chronic disease groups. The key point here is the alignment between optimal outpatient care for these fragile patients to manage their health and avoid illness, exacerbations, and disability. You made it. Your hot beverage is either gone or getting cold by now. Hopefully, you feel a little more prepared to consider reporting MIPS using the Value in Primary Care MVP. All of the information for this video was obtained from the QPP website. Go to the qpp.cms.gov link shown here, and you will find an additional link for the finalized 2025 MVPs guide. And of course, your practice support coach is here from you. Take care.